and welcome to Health Options. I am Rabi, Abdallah. Thanks for joining us on the program. The eye is a very important organ of the body that enables us to see. So many factors, including disease conditions, can become a threat to the functionality of the eyes. Members of Ruga, a makeshift community, got badly hit by an eye infection that was spreading like wildfire before treatment was eventually taken to their doorsteps. On this edition of Health Options, we're having a deviation from the format you're used to, and this is due to developments in Ruga community. Ruga community is a makeshift settlement in the outskirts of the Federal Capital Territory, located along the airport road. It has all the trappings of a slum without a single social amenity. This is the community's only source of water, and as for the hazards that could come with such unhealthy source of water, your guess is as good as mine. As expected, the risks of dwelling in such a community begin to manifest.
We notice some with scabies, and we also notice some that has things coming out from their eyes. Apart from the blindness we are talking about, there's other skin problems that we notice in these children.
A lot of problems because of this water. Like me, if I brought it, I will even find a treatment to treat it. But even right now, our people doesn't care about that one. They don't have education on that one.
The situation in Ruga, having been brought to public notice, got both the officials of the Ministry of Federal Capital Territory and their counterpart at the Federal Ministry of Health on their feet, and off they went to Ruga.
It's not an outbreak. It is allergic conjunctivitis. The eyes are reacting to something in the environment. So if the eyes get swollen, they get red, it brings out fluids, and the treatment is very easy, and they've been providing that treatment. What we need to do is to focus on what is the reason for the allergy.
The team from the Federal Ministry of Health was led by consultant ophthalmologist Dr. Ibrahim Kana, screening the community members with the instrument ophthalmoscope. He soon came up with findings regarding the eye disease ravaging the community.
Clearly, one has to really completely throw away the rumors that people or children are getting blind in this community. Actually, it is not true. It is completely false and is a fake news, so to say. What really I have seen here in this community is an outbreak, if I may call it. Several people actually having conjunctivitis, whereby they are presenting with discharge from the eyes, associated with redness, which sometimes happens in rainy season like this. Most importantly, it is so easy to transmit the infection from individuals to individuals. Now you can see in this community they are of low socioeconomic status. They don't appreciate the importance of hand washing. You will see many people here that are already infected with the infection, that are using handkerchief to be cleaning their eyes and holding the same handkerchief. So now there's a possibility of one, the reinfection, two, continuous infection of people within the community. They are not also aware of the fact that they can also infect their children and also their spouses. And we can see here that a lot of families, both husband, wife, and children are all infected. But most importantly is the issue of personal hygiene. Awareness creation is so important because if people are not properly educated, the infection will continue to be transmitted. So we're advising the community, one, to ensure proper personal hygiene, environmental sanitation. In terms of personal hygiene, hand washing is extremely important. They must continue to wash their hands. And we are advocating to them also that as they are cleaning their eyes, they must, as much as possible, use maybe cotton wool, but not handkerchief that they continue to reuse. Whatever they use in cleaning their eyes, they should throw it away and not to reuse again. That is extremely important to prevent reinfection and further spread of this infection.
Worst hit in the community is the family of Suleiman Aliyu. Findings, however, revealed that Muhammadu Buhari, the family's 2-year-old son's blindness, isn't as a result of the conjunctivitis infection.
See, when you have information like this, you have to look at the the village head, whom we met, and we asked him to bring whoever, any child that is blind. And really, there's only one child that is bilaterally blind. And his blindness is not a blindness, it's not an acute blindness. It's a child that has been blind for over 1 year. And his blindness clearly, obviously, he suffered from bilateral keratitis, measles keratitis, which has caused his blindness. From the information the mother gave, they were admitted in Wuse Hospital and eventually in Ahmadu Bello University Hospital in Shika, on the ophthalmology department. So clearly you can see there's a history, that led to his own blindness. So not as a result of the current situation that they are having, really. First of all, we are going to treat all of them. We are going to give them antibiotics, to treat the infections. For those that have allergic conditions, we are also going to give them drugs to take care of them for free, of course, from government.
Call it walking the talk, and you won't be wrong. Following the assessment visit and the confirmation of conjunctivitis, the team from the Federal Ministry of Health took eye treatment to the community where all those affected benefited.
Bayan gaisuwa mai yawa, mai gari ya ce a gaya wa babba da yaro namiji da mace wanda ke fama da lura da ciwon ido ya zo fara za a bashi magani.
The announcement of the arrival of the officials from the Federal Ministry of Health, led by consultant ophthalmologist Dr. Ibrahim Kana, got affected members of the community, young and old, troop out in their numbers for the free eye treatment, which was followed by a health talk on personal and environmental hygiene.
From our visit last week, the number of patients that we saw, actually today we became overwhelmed, with the large turnout of patients, and incidentally, many of them actually have one problem or the other. But the good news is that all their problems are not blinding problems. There are problems that are actually treatable. There are problems that are actually curable. Therefore, we came prepared with a wide range of drugs, from anti-allergic drugs to analgesics, and also some other drugs for other minor illnesses, which were able to intervene as we see the patients. So overall, despite the fact that we overwhelmed the number of patients, but we were well equipped with adequate medications, which we took care of. And the good thing is that even as we are living now, we still have large quantities of drugs that we're taking back with us. But that's not to say we've come to the end of the activity. Activities like this, one is for the community to imbibe the habit of personal hygiene and environmental sanitation.
Regarding the eye diseases trending in this community, and decided to intervene by bringing drug supplies to those affected. What have you got to say to government for what has been done to the community here?
I'm very grateful to see today that we achieved our response. The government has responded our calling that we have problem of eye that affecting the community and entirely, and also we publish it and government respond. Today I'm very grateful that to say thank you the government, thank you to everybody that has been attempted today, and our people has benefited so much, and thank you very much with you coming.
Yes, he does. In fact, he eats all the time. I want to do the main plenty. He eats it all the time. So as it is now, the socket. Jumbo. Lagini. What is that? Don't ask about the one to follow up with that.
ba ka zo a yi ma bane ka samu guri kuma ka zo a yi ma in ba ka zo a yi ma ba ba
He does. That's why he eats all the time. I won't do them plenty.
Beyond the treatment intervention is this food for thought.
We as government also must always be routinely visiting the communities on an outreach basis, to be able to identify problems and treat them on time. In a situation where a primary healthcare center is not readily available, because obviously this is a makeshift community, therefore one cannot say you can really come and set up a primary health center per se, but they will definitely benefit from regular outreach, medical outreach activities, which it's common actually with the local government, in this case the area council, as well as this FCT government, as well as the federal government, because it is our responsibility, all Nigerians, including non-governmental organizations, to reach out to communities like this who are actually in need to be able to provide services for them. And as we do this, we continue to reduce the prevalence of blindness in Nigeria, reduce taking care of curable causes of blindness, and also addressing issues of blindness on time, so that we'll have a population that will see and a population that are healthy. So that a healthy nation is actually a wealthy nation.
Ina godiya da taimakon da gwamnati ta taimaka mana, ina kuma farin ciki Allah ya saka mata da alkhairi. Kuma da kuka zo kai mana, ina muku godiya, Allah ya saka muku da alkhairi.
Apart from Ruga, there are other makeshift communities around the Federal Capital Territory, though not officially recognized, hence the exclusion from basic social amenities. The question here is, should they really be ignored or neglected, considering the risks such communities pose to the larger population? Ruga is the focus here, a wake-up call for the Abuja Municipal Area Council. Hand wash hygiene is said to be quite important in disease prevention. As the world marked the 2018 Global Hand Washing Day, the Federal Ministry of Water Resources, that of Health and Environment, have decided to join forces towards enhancing water and sanitation in the country. Musbah Dan Wahab tells us more about it.
It's 10 years since United Nations set aside October 15 as Global Hand Washing Day to raise awareness on hand washing with soap to prevent diseases. But since then, the campaign has not made much impact, with statistics in the sector still alarming. A UNICEF report says children across the globe miss 272 million school days each year due to diarrhea infection. And Water Resources Minister Suleiman Adamu says Nigeria is having a fair share in this.
Over 59,000 children under the age of 5 die annually in Nigeria from diarrheal diseases attributed to poor water and sanitation. And about 33% of children under 5 years are stunted. The absence of wash facilities, including hand washing stations in schools, healthcare facilities and workplaces, is an equity issue for girls and women, particularly for menstrual hygiene management. The availability of hand washing stations can stop the spread of diseases in these settings. It must be noted, however, that the benefits accruable through provision of these facilities depends on the utilization. Behavior change is required for people to wash their hands consistently at key times. Hand washing is a choice that we need to make multiple times a day. When we choose hand washing, we are choosing to create a healthier environment, not only for ourselves, but also for those around us.
To intensify this campaign, the ministry is set to sensitize policymakers on the cost-effectiveness of hand washing with soap and involve private sector to sustain the promotion.
All these activities are aimed at engaging children as agents of change and creating massive awareness across the country on the adoption of the habit of washing hands at critical times. As I conclude, the tagline, Clean hands, a recipe for health, remind us to make hand washing a part of every meal. I therefore enjoin us all to always remember to use this key recipe for health and be an advocate for making it a habit as we celebrate the 2018 Global Hand Washing Day. We should choose hand washing not only on Global Hand Washing Day, but every day.
Development partners in the sector say they are now targeting abattoirs, marketplaces and schools to boost the awareness on hand washing and general hygiene practices.
Most of the meat that we eat in this country comes from abattoir. And if you go to the abattoir areas, you see that it's an eyesore. The hygiene aspect of it, the sanitation aspect of it is really not there. And yet, a lot of people fall sick and we attribute it to so many other things. So for us and as an organization, we feel that yes, hand washing is very critical, but if we are talking about the issues of sanitation and we are looking at the implication it has on health, we really need to begin to target the critical areas, the critical places that we feel that should be taken on board. And that is why WSCC is going to abattoir at this point in time.
Nigeria wants to become open defecation free nationwide in 2025. So we are in the forefront of wash activities.
With various policies and programs set in motion by the federal government to address sanitation challenges, participants here say state governments need to follow suit with more purposeful commitments in this regard.
Many thanks, Ms. Bahu, for that report, which should be a reminder of the importance of hand wash, personal and environmental hygiene. And it is on that note that we end this special edition of Health Options. You can go to our YouTube channel to watch the uploads of these and other episodes of the program. Email us for your comments and contributions at healthoptions@nta.gov.ng. I remain Rabi Abdallah. Thanks for watching.